नया साल নতুন বছর নিউ ইয়ার नया साल मतलब new beginning, new opportunities, new happiness, new dreams, new problems, new solution. Hello, namaskar. मैं हूँ राधिका अग्रवाल once more and after a long time in this Facebook live with Healthworld Hospitals. Today we have with us one of the executive directors, Moushumi Lodh ma'am with us, who is working right now with Healthworld 300-bedded tertiary hospital in Gandhi More City Center, Durgapur. Hello ma'am, how are you?
Hi, good afternoon everybody.
Ma'am, we have heard that Healthworld Hospital, Durgapur is organizing a seminar. So can you please give us details about it?
Yes. So today my visit here is for a specific purpose. আপনাদের সবাইকে এটা বলার জন্য যে আমরা জানুয়ারি 21 এ একটা যেটা আমাদের এবছর আমাদের 5th ইয়ার হেলথওয়ার্ল্ড হসপিটালের 5th বার্থডে হতে চলেছে। তো এই প্রসঙ্গে আমরা ওয়ার্কশপ একটা আনছি জানুয়ারি 21 এ হেলথওয়ার্ল্ড হসপিটাল অডিটোরিয়ামে হবে। এই ওয়ার্কশপটা আমরা করছি আন্ডার দ্য ফ্ল্যাগশিপ অফ আ ন্যাশনাল বডি দ্যাট ইজ দ্য অ্যাসোসিয়েশন অফ মেডিকেল বায়োকেমিস্টস অফ ইন্ডিয়া। তাদের যে ওয়েস্ট বেঙ্গল চ্যাপ্টার, সেই চ্যাপ্টারের আন্ডারে আমরা এই ওয়ার্কশপটা করছি। উই আর ভেরি প্রাউড অ্যান্ড থ্যাঙ্কফুল টু দ্য ওয়েস্ট বেঙ্গল চ্যাপ্টার অফ AMBI for allowing us to host this first pre-conference workshop in our hospital, and we are getting a good response from everybody. অনেকেই রেজিস্টার করেছে, অনেক দূর দূর থেকে রেজিস্টার করেছে। এই ওয়ার্কশপটা আমরা হাইব্রিড মোডে রাখছি, অন সাইটও থাকবে লোকজন অ্যান্ড অনলাইনও অ্যাভেলেবিলিটি থাকবে। একটা বেস্ট ইভেন্ট ম্যানেজমেন্ট কোম্পানির সাথেও আমরা টাই আপ করেছি কলকাতা থেকে, হু উইল বি ট্রান্সমিটিং ইট টু অল দ্য অনলাইন অ্যাটেন্ডিজ, and we will have national level speakers coming from Delhi and Durgapur and Kolkata. So I hope like our earlier workshops ebaro jate amader workshopta ekta success hoy, apnara shobai join korben.
Ma'am, এই ওয়ার্কশপের জন্য কারা এলিজিবল? Who can join this?
Yes. তো এই ওয়ার্কশপটা বেসিক্যালি আমরা মেডিকেল স্টুডেন্টস, MBBS, MD, DNB and also PhD students এদেরকে আমরা এক্সপেক্ট করব রেজিস্টার করবে। আমরা এখানে ক্লিনিশিয়ানসদের এক্সপেক্ট করব, যেমন স্পেশালি নেফ্রোলজিস্ট, অর্থোপেডিশিয়ানস, জেনারেল মেডিসিন, neurologists, all these doctors who see cases related to diseases where you need electrophoresis to be tested. I will expect that all of you will join us. এছাড়া আমাদের যত প্রাইভেট প্র্যাকটিশনার্স অ্যান্ড জেনারেল প্র্যাকটিশনার্স, who then we have these laboratory doctors, we have pathologists, microbiologists and biochemists definitely who should join us. কেননা it is all about testing processes. এছাড়া যত ল্যাব ওনার্স আছে বা যত সিনিয়র টেকনিশিয়ানস, অনেক জায়গায় খুব সুন্দর ল্যাব চলে যেখানে খুব সিনিয়র ল্যাবরেটরি টেকনিশিয়ানস আছে, আমরা চাইবো তারাও এতে জয়েন করুক। আর এই ওয়ার্কশপটাতে আমরা সার্টিফিকেটও ইস্যু করবো, AMBI অ্যাসোসিয়েশনের তরফ থেকে সার্টিফিকেট ইস্যু করা হবে। So I will expect all these people to join the workshop.
Obviously, we are also expecting that you can join over here. Ma'am, it is online or on-site?
Yes, এটা হাইব্রিড মোডে হবে বিকজ কোভিড প্রোটোকল ফলো করতে হবে আমাদেরকে। তো আমরা অনসাইট 40 জনের বেশি we don't wish to take on-site. আর online, but we will take up to maybe 100 registrations we will take online.
So following every COVID protocol, accordingly you can take only 40 people on site.
40 on site.
Rest all online can join. So you all can join online. Only 40 are allowed as on site because of the COVID protocols. So we expect that everyone should join this.
Basically, we will be having the instrument also coming from the instrument which we will be showing. It is an automated machine from France, and all that entire experimentation will be done here in our auditorium. But present, we will on site we will be taking 40 persons. The rest will all be seeing it through in a webinar mode.
Okay. Now, what is electrophoresis testing? Can you explain about it?
Actually, what phoresis means migration, and this technique, it is a type of laboratory testing where these protein molecules in our blood, they are subjected to electric current. So when they get this charge, in the presence of an electric charge, these proteins, they move towards they act like anions and they move towards the anode. So then what happens, like our protein in the blood, it actually, broadly when we look at it, we know that albumin and globulin are the two common proteins. But when we take the blood sample and we subject it to the electric field, these proteins, we get up to 6 bands of proteins in this sample of blood by the effect of this electric charge. So basically it is a separation technique. It is a technique to separate out the different types of proteins and then to analyze each band and to see if that band is normal or abnormal, and or whether there is any abnormal. If there is any abnormal band is there, then we report it like that.
Okay. मैम तो इसका यूज क्या है, किडनी डिसऑर्डर्स या कैंसर?
So mainly, most commonly we do it like for diagnosis of hemoglobinopathies. So hemoglobinopathies like sickle cell anemia and thalassemia, as we all know, these are very common in places like West Bengal and many parts of India. These are very common disorders. Yeah. So it, as a routine matter, any premarital, just before going in for marriage, you have the couple screening for these diseases. Then any newborn baby routinely has to undergo these tests. So these are very common tests which are done. So for hemoglobinopathies, to detect if that person has got sickle cell anemia or thalassemia, we do this test. And then we do it for chronic kidney diseases. People who are around 50, 55 and who are suffering from chronic kidney disorder since a long time, they should routinely undergo the serum protein electrophoresis. Because we have seen that in many cases they have this M band positive. So if by this test at an early stage of this kidney disorder, this M band can be detected, then the treatment can start early and all the complications like the repeated bone fractures, then osteolytic bone lesions, all these can be prevented or it can be stalled by quick diagnosis and quick start of treatment. So then the third category which we commonly do it for are the cancer. Now in cancer there is a term called plasma cell dyscrasia. So these plasma cells which are present in the bone marrow and in the blood, they undergo malignant transformation. खूब ताड़ाताड़ी they start multiplying. Then it becomes a cancerous condition. When they become, they increase, they proliferate to such an extent that they go and get deposited in other organs of the body like the kidney, the bone, the intestine, the stomach, in all these places, and then all these organs will start getting affected. So what we aim to do by this electrophoresis test is to see if there is this M band, and if it is there, if the M spike or M band is there, then we diagnose and we, this is a screening test. So thereafter we go into the bone marrow testing. There also if we find that yes, these plasma cells are present to the extent of more than 10% or so, so then we are sure that okay, the person may be having multiple myeloma. So then the treatment can start accordingly. So these are the common areas, common diseases for which this testing is done in our hospital, and we are doing it since 2017 in our hospital. So quite a few cases of these disorders we have been diagnosing.
And what are the other benefits of this test?
Yes, this electrophoresis test is useful. You can find out the lipoprotein, familial lipoprotein disorders through this testing. There are disorders like multiple sclerosis which can be diagnosed by these type of diseases. So any kind of protein fragments which can be separated out and then the abnormal protein detected to diagnose a disease, you can use this technique.
ম্যাম তাহলে এই যে টেস্টের ব্যাপারটা আপনি বলছেন, এটা কি আমরা সবাইকে অ্যাডভাইস করতে পারি or there are particular sections who can be advised?
Generally, like I told you, like all newborn babies mandatorily have to undergo these for this sickle cell and thalassemia, metabolic disorders. When they are getting screened, they also have to undergo the screening to see if they are having these type of hemoglobinopathies. Then all people, all males and females who are going into the marriage they have a premarital screening for these parameters. Because if you have a thalassemia girl, if it is a disease state, not a trait, then it is risky if she marries another person who may be having a sickle cell disease condition. So in that case, having this preliminary test will make them aware that this is the risk zone they are entering, and then they can go into genetic counseling and take decision thereafter. So these, besides this, these are the normal situations where people have to undergo these tests. Then I told you, in chronic kidney disease, invariably all patients of chronic kidney disease must be screened for M protein. Then besides that, you have patients generalized symptoms like weakness, asthenia, then you are having bone pain, back pain, then unexplained fractures, repeated fractures person is having without finding any proper reason for it. So in all these cases, you have to check for serum protein electrophoresis, or electrophoresis testing has to be done for these persons. So these are the general.
So ma'am, can you please guide all the viewers about the rate of the test in Healthworld Hospital?
Yeah, actually, the pricing of the test ranges anywhere from 1500 to 2000, depending on what the test is, whether it is protein electrophoresis or hemoglobinopathy or lipoprotein electrophoresis. So there are many types of electrophoresis patterns which are done. So pricing would be anywhere.
Affordable. To know this type of diseases, it's really affordable in India.
And it is a very necessary screening test which should be advised, which should be recommended by general practitioners and all. And further on, the same test is also done, to check for any problem in the DNA and RNA also. So I was just mentioning about the common proteins which are definitely to be tested for on a regular basis.
Ma'am, and what about the reports? When will you get the reports, the people who are doing this test?
We do the testing in our lab, like we do it 3 to 4, in every 3 to 4 days we have the batch of tests, process them. Since it, so that is about, you can expect the reports to be out within an average time period of 3 to 4 days.
3 to 4 days. If you are going for the test, you will get the reports in around 3 to 4 days. And if you have any problem, you can contact her directly. So they are always available everywhere, every time. Ma'am, what about the accuracy of the rate?
Yeah, actually this electrophoresis is a screening test, and sensitivity is about 92% sensitivity is there. So once we get this as positive, we also go in and see the bone marrow, plasma cell count and all. So once that is also fulfilling the target count, so then it is confirmed that the person is having multiple myeloma.
Okay. Ma'am, and the workshop which is going to happen, and do we need to pay any registration fees?
Yes, so like I told you, we are having this workshop under the flagship Association of Medical Biochemists of India, West Bengal chapter, and so for that we have kept a nominal fee. The registration fee is for AMBI members if it is online, it is 300 rupees, and if it is on site, it is 500 rupees. And for non-AMBI members would mean all other pathologists, microbiologists, clinicians, senior laboratory technicians, any lab owners who would like to start this test, or all our DNB, MD, PG students of other departments, besides being an AMBI member. For all these people, we will be having a charge of registration fee. For online will be 800 rupees and 1000 will be if they are attending it on site.
Okay. Ma'am, quickly please tell the date of the workshop.
Yes, so please remember 21st January 2022. We will expect all of you to join in, and like every other workshop which you have been with us and made it a success, we hope to see you all with us, and thanks.
Well, now remember it's 21st Jan. Note it down or set on your mobile phones. You have to be here. Thank you so much, ma'am, for this great workshop and great news what you provided to us. Well, guys, very happy new year. It's a new year. With this new year, new COVID variant. You know that very well. But for that, I hope we all always follow the COVID protocols and the vaccinations which are, I guess, going to start. Everyone should take that vaccination and be safe. So before stepping out from your house, wash your hands, wear your masks, use the sanitizer all the time and keep distance. Thank you so much. Please attend the workshop and we'll meet again in the next live with a new doctor.
Thank you.
Thank you so much.